Hello, and welcome to your introduction to Health and Social Care Cambridge Nationals. This is a Level 1, Level 2 course and is an equivalent to a GCSE 9 to 1 grade. With the demographics in the UK changing rapidly and the population living an awful lot longer than they ever have done, health and social care sectors are going to experience a huge amount of growth over the next few years. And so, for those wishing to work in either of these sectors, this qualification provides a really solid foundation of not only knowledge but practical skills and experience. The qualification is focused on person-centred values, and so that looks at the rights as us as the individual accessing both healthcare and social care, but also from the point of view of working in health and social care, communicating effectively and protecting those individuals, whether they are our patients or are people accessing the services. The qualification is designed to help students learn practical skills that can actually be applied to real life contexts and work situations. So, how does the course look? Well, we have 3 modules in this course. The first one is RO34 Creative and Therapeutic Activities. In this, you will learn all about the range of creative activities and therapies that can be used within both health, within the NHS, and social care services to help support the individual. Whether this be physical therapies such as yoga or massage, intellectual therapies such as reminiscence therapies for people who suffer with dementia. We will get to look at all of these and even try some of them out. We will look at play therapy through Lego. We will get to do some art therapy. And in the end of it, you will plan and deliver your own creative activity. In Module RO33, we will support the individual through life events. So in this module, you will look at life from birth to death and everything that happens in between. We will look at the different life stages that every person passes through during their life and the different things that affect them. So, for example, a toddler learning to walk and to talk, a teenager going through puberty, or going into retirement age as well. We will look at the impact that expected life events such as going to school, getting married, having a career have on people, but also some unexpected life events too. So things like long-term illnesses or life-changing injuries, and we look at a case study of Billy Munger. We look at how these impact us physically, socially, and emotionally, but also socioeconomically. How losing a job may impact the lifestyle that we have and other things like that. Our final module is RO32, which is the Principles of Care in Health and Social Care, and we will learn about the importance of the rights as us as service users, the rights that we have entering into the NHS as a patient. We will look at person-centred values, how it is important that our care is tailored to our individual needs. On the flip side of that, we will also learn as health and social care practitioners the importance of effective communication skills with our patients and how it is best to support those needing our care. So what does this actually look like then? In short, it's very similar to the BTEC qualification, which we'll have heard of before. All the coursework elements contribute to the final grade. And as you can see on your screen there, we have the GCSE equivalent grading. The first module that we do is assessed via coursework in year 10 and makes up 30% of your grade. The second module is also assessed via coursework and is assessed in year 11 and makes up 30% of your grade again. This means by January of year 11, you will have 60% of your grade already secured. And then our final module, RO32, is worth 40% of your grade and is examined along with all the other GCSE exams in the summer of year 11. The pathway for health and social care looks as it is on the screen. You can move on from Key Stage 4 to Key Stage 5 and do Cambridge Technicals. You can then progress on to university, into employment, or go on to an apprenticeship as well. The careers for both health and social care are very vast, but however, here are a few for you to look at. Do feel free to pause the screen if you want to look at them any further. I'll give you an example from each column. You could work as an environmental health administrator. You could work as a housing and community development director, or you could work as a guidance counsellor. Just 3 of the jobs involved in social work there on the screen. Of course, I would be wrong to miss out the healthcare occupations as well. Again, feel free to pause if you want to read into these further. However, one from each column again. You could be a surgeon, you could be a hospice nurse who helps people at end of life, or you could be something like an optometrist or an optician. There are many, many, many more pathways that health and social care can take you through. If you have any questions, please see myself, Mrs. Power, or any of the students studying the qualification in Year 10. Alternatively, please pop to BF3 during the options evening and I can answer any questions you have there and show you some examples of the activities you will have a go at during your health and social care career. Thank you.